Hello everyone, I'm Anchal from DSW program. Today I'm going to explain right or I can say proper procedure of administering medication when you are specifically working with the people with intellectual disability. So as a DSW, when you are administering medication, you should make sure that the surroundings are safe and you are respectful to the person and you are maintaining the confidentiality and privacy of the person. So for administrating medication we have 10 rules, I can say. So let's count with me. Right person. So when you are giving medication, make sure that you are giving medicine to the right person. Right medicine. When you're giving medicine, make sure that it's the right medicine for the right person in the right dose, that you are giving right medicine in the right amount to the right person on the right time and with the right route. Like you are giving with the right route. For example, if medication is taken oral or topical maybe, so you are following the right route with the right dose, the right person, with the right time and with the right medicine. And then we have right documentation, that you are documenting the right report, like what effects happening, and you are signing the right medicine which you administer, not your co-worker and not your another person. Then you have right to refuse. The person have all the right to refuse that he don't want to take medicine. Then we have right response, like I can say, like in way, like we can see we have what it's the right effect which that's why the person take this medicine, that person having the right effects, like the person is cured now. Then right reason, that why the person is taking this medicine. And right to education, like the person know that why he is taking this specific medicine. So for starting the procedure, I am going to start with one example. So for example, there's one person and he take his regular medicine at 8 in the morning. So how to take this medicine? So as a DSW, first I'm going to start that okay, this person need to be administered this medication at 8 a.m. So first of all, I'll clean my hand, wash my hand, wear a pair of gloves, and then I'll be up with my MAR documents and started to look for the person document, MAR sheet, and I look for the right medicine which should be administered at 8 a.m. Then I will look for the right packets, like the pack mats, where it is placed, and right route of administering medication. So for example, right now where I'm working, like I'm doing my field placement, there we mostly use this kind of pack mats where all the details are given. Here I already tiered this, but at this place there is the time, like you can see at, so it is given at, for example, it's 8 a.m. and here should be the person name, and here you can see the Friday is November 24. So here's the date and time, the person name, and there was 3 tablets in this pack. So all the 3 tablets name, like the chemical name. So we have all the details on the voucher, so we can match these details with the MAR sheet and with the right name. So, and if you are specifically, like if you're a casual worker or you are unaware, if you don't know the person identity or appearance, then make sure that you check the photo and you take help from your experienced co-worker if there is somebody with you to help you with the person, to know the person before administering medication, because it is very important not to make any error while administering medication. So make sure, if you don't know the person, communicate with the person before administering medication. Let them know that you are administering their medication. Communicate with the person that with the right name, with the right identity, so that you can make sure that you are administering right medicine to the right person. Then you can just tear this up and you can draw the medicine into the medicine cup. So now we have different it's depend on person to person how they take medicine. Like some can swallow the whole tablet in the tablet form, but some don't. So it's depend on, like, you can use the tools which are provided to us, like for crushing, for splitting, and for the whole pack. So use that tools and give the person right medicine. So now for administering medicine to the person, as I told, that make sure that person is aware that you are going to administer medication. So person is already up and he's aware that you are going to administer medication. So bring the medication to the person, and if he's swallowing with water or any other liquid, or maybe he's swallowing the crushed medication with the food, so follow the proper guideline, which is person centered, person directed. So it depends on person to person. And don't forget to sign the MAR after completing medication, because it is very important that you administered that medication. So you should be responsible for signing the sheet, MAR sheet, which medicine is administered by you only. And make sure that you are not signing for your co-worker. For example, if your co-worker administers somebody's medication but he asks you to sign, please don't sign for your co-worker or for anybody else. Just sign the sheet which you administer, not for others. As I mentioned that the medicine is regularly taken by the person at 8 a.m. so it is very, like, common for him. But make sure for the effects, as I mentioned, right effects, right response. So make sure if person is having any side effect or anything, so just take care of that thing.